Welcome back. Let's take a look at the political response. We've heard the doctors. Let's take a look at the political response to this national oxygen emergency. A crucial meeting happened on Friday where the Prime Minister spoke to chief ministers of 11 states. One would expect that some very serious decision making or solution giving or solution seeking must be happening. But see what happened.
ये हमारी जो परंपरा है, हमारे जो प्रोटोकॉल है, उसके बहुत खिलाफ हो रहा है कि कोई मुख्यमंत्री ऐसी इन हाउस मीटिंग को लाइव टेलीकास्ट करे। ये उचित नहीं है। ये हमने हमेशा संयम पालन करना चाहिए।
So Arvind Kejriwal was speaking, the Delhi Chief Minister. He was interrupted by the Prime Minister. The Prime Minister gave him this advice. He said, fine, I'll keep that in mind. The point is, and I want to go across to our guests, Priyanka Chaturvedi, Rajya Sabha MP and leader of the Shiv Sena, Ghanshyam Tiwari, spokesperson of the Samajwadi Party, Vijay Jolly, leader of the BJP, and Jasmine Shah, leader of the Aam Aadmi Party. Thank you very much. Jasmine, let me begin with you first. You know, to televise a portion of a crucial meeting with the Prime Minister, what was the purpose behind it? I understand that this chiding could have been out of place, the chiding should not have taken place so publicly, but what was this great joy in broadcasting your conversation with the Prime Minister? See, the point is, ultimately people are watching. Those who are gasping for breath are watching all these antics of politicians.
Sanket, first of all, there has already been a statement of clarification issued by the Chief Minister's office on this. The address was shared live. Only the CM's address of 5 minutes was shared live because there was no instructions whatsoever from the Prime Minister's office or from the central government, written or verbal, that this was not supposed to be done. And there are many instances in the past where similar interaction of PM with the CMs has been shared live. And, especially when things of national importance are being discussed, where there is no matters of national security or confidentiality that is being violated. But this is a matter that has seized the nation. This is a matter that has seized the people of Delhi, and they have a right to know what is going on, what are the decisions being taken.
Okay.
No, but again, if there was an unintentional sort of concern that center has expressed, we've already regretted it. We want to move. I mean, these are matters which was understood. It has been communicated. Sure. Let's focus on what was discussed, which is the oxygen
absolutely.
crisis.
Vijay Jolly, I want to come to you now. Yes, we know what the reason why everybody assembled. Mr. Vijay Jolly, see, the point is, even if a protocol was not followed, to which the Aam Aadmi Party says, why is that protocol not applicable on the Prime Minister? Because he speaks all the time. Televised address in the same PM-CM meeting, the one that happened on 8th of April, Prime Minister's speech was televised. That should not be the main issue of concern, that protocols are being followed or not. What was the great solution that was found? See, because oxygen crisis is now. This is not the time to follow fixed protocols.
Sanket, after Prime Minister raising his objection to an in-house meeting being publicized live on the social media and on the media, and after the Chief Minister offering unconditional apology, the issue stands closed. I do not want to make a political or a publicity gain on that particular point, but the point is that in this corona pandemic, today's statement of the Prime Minister, Mr. Narendra Modi, calling for a united efforts, a united strategy, and assuring center's full support to the states, and also roping in railways and air force for airlifting immediately the oxygen supplies to various states of the country, should be considered in the positive perspective. No one has a right to make a political gain or loss out of these meetings. The need of the hour is concentrated efforts, no politicking, no publicity blitz.
Then why did the BJP feel the need to release the clip of the Prime Minister chiding? Why did the BJP feel the need, by way of sources, to basically say Arvind Kejriwal is playing politics, we have given so much? You also don't do it, no? Unfortunately, this is the response.
I wish to
Maharashtra versus Delhi.
And deny that the BJP
Arvind Kejriwal
has
versus
done
Delhi.
So. It is the national channels who have put those clips on the social media as well as on
Sir,
the
surely it must have come from somewhere,
and
no?
the WhatsApp, etc.
It has come from somewhere. No, it has come from the government. I don't have access to government servers.
Obviously, it does not come from the BJP. So, Mr. Sanket, you will be unfair to my party, to my government.
I'm just saying, let political parties not be unfair to the people. Priyanka Chaturvedi, I want to bring you in at this moment. See, Maharashtra versus center, Delhi versus center, many other states versus center. Is this an ideal response? We have an oxygen crisis where we are fighting a battle every hour. Every hour.
Okay. If you provide...
If Mr. Jolly can stop speaking, I'll be able to answer.
Yes, Mr. Jolly, I'll come back to you. One moment. Yes, Priyanka Chaturvedi.
Now, whether it is a chief minister, whether it is a members of parliament from the opposition who have written, including the former Prime Minister of India, who wrote good suggestions, gave good feedback and suggestions rising above their political differences, were mocked at, were getting political responses, and every suggestion that was given to them. For example, when Shri Uddhav Thackeray wrote to the Prime Minister saying that, why don't you universalize the vaccination for above 25 years of age? When 12 crore population in India, out of which 5 crore is between the 18 and 45 age group in Maharashtra, half of our population is that. When we spoke of oxygen, when the Chief Minister wrote to the Prime Minister that why don't you look at airlifting oxygen, again, Maharashtra BJP mocked it, laughed at it, and today what do we see? The same idea being implemented. The idea is right now to rise above our political differences and to be able to make a point and make a collective call on this. Unfortunately, that's not coming across. Secondly, I just take another 1 minute to say that as far as protocols are concerned, we do understand that there are not many written rules across the constitution, etc., or parliamentary processes, but there are protocols which are followed. So now if you say, oh, you are part of the Consultative Affairs Committee in External Affairs, so you should go live whenever you're speaking, I think that is a bit something that we should all refrain from and not make something political when solutions can be found. That is all. Let's maintain the decorum and maintain the, I would say, unwritten rules of how governments work and how federal structure cooperates and works. We've had many ups and downs. We've had political responses. But let's work together. That is the need of the hour. And I'd just like to say our Chief Minister has written again, making a demand for oxygen. And just on that oxygen bit, I wanted to let you know, on April 18th, the Ministry of Health and Family Welfare sent a letter out, asking the Bhilai plant from Chhattisgarh to reduce the oxygen availability to Nagpur from 110 metric tons to 50 metric tons. This was, this was struck down by the Nagpur High Court, which said, Mumbai High Court, I'm sorry, which said this is absolutely unforgivable, that at a time like this, instead of adding more oxygen to their quota, you're reducing it by half.
Okay.
So
Mr. Jolly, I want to quickly come back to you.
Just one last thing.
Sure.
The oxygen corridor, the green corridor that, the railway minister has been pumping about and talking about and doing a huge PR gig around it. It was sent to Maharashtra on 19th April. From 19th April till date, it has just reached Visakhapatnam. From Visakhapatnam, the idea was the urgency. I'm just trying to tell you the amount of time wasted. Like the Supreme Court has given 1 week off for oxygen supply. The same way, 19th April, lots of pomp and show done about it. 23rd April is when it reaches Visakhapatnam. And at the rate at which it has reached Visakhapatnam, if it takes time to return back to Mumbai, it would already be the 25th of April.
I think this is a very important point that is being raised by Priyanka Chaturvedi. We are wasting crucial time. Why has everything become about publicity? Mr. Jolly, before I go to Mr. Tiwari, I want to come to you, Mr. Jolly. Why has everything, I mean, the railway ministry would like to, it's good that these Ro-Ro trains, but they should move fast, no? Ro-Ro ke nahi chalna hai, just because that's the name.
You see, Sanket, I again would wish to reiterate. I do not want to make a political statement or a political...
No, not political statement. I'm just saying what is an apt and immediate response. See, the crisis has to be dealt with in hours, not days, but hours.
Sanket,
it's that sort of emergency.
Sanket, the crisis in Delhi as well as in Maharashtra was not overnight. What was the Maharashtra government doing when this whole crisis was at its peak? Were they not foreseeing how much quantity and metric tons of oxygen would be needed for the citizens
Mr.
of
Jolly,
Maharashtra.
by that logic,
One
did
month or
UP
1
not
month and a
foresee
half ago,
their requirement?
overnight-
Why are hospitals
overnight
running dry of
you
oxygen there?
fuck up your,
Did MP not
you
see,
fuck up
once
your
you,
statistics,
at one
fuck
point
up
you
your
say,
demands.
I will not get into blame game, and then you do exactly that, Mr. Jolly.
Yes, I have to. When my other panelists are accusing the center of doing very little, I wish to state on record, I would have avoided taking this whole debate in the political direction. But were the states sleeping initially in their statistics, in their projections, in their demands, how much metric ton of oxygen would be needed for the citizens of Maharashtra at the height of
Let me
pandemic
quickly
and
get a
even in
response.
the capital?
Very quickly, since Mr. Tiwari has not spoken, let me give him an opening comment, and then Ms. Chaturvedi, you can respond. Were states sleeping? Because if you would have anticipated this, the center, Mr. Jolly says, the center would have been able to arrange this oxygen, or we would have been prepared better. My point is, even if we did not anticipate this then, are we handling this crisis well now? I don't think we are doing that even now. Very quickly, Mr. Tiwari.
Well, at 5 p.m. today, the Prime Minister announced that he is doing a virtual rally in Bengal. The Home Minister has not stopped his actual rallies and virtual rallies in Bengal. This entire government was sitting on petty politics in Bengal, and that has doomed the entire country. What Arvind Kejriwal did today, Chief Minister Arvind Kejriwal, he exposed the hollowness of some of these meetings, which are very high level. But the Chief Minister is made to plead to the Prime Minister. He is not giving specifics. What he is saying is you should not televise this meeting. Here are the specifics. You tell me who is the empowered committee who is talking to all the chief ministers, because clearly Home Minister is not part of that empowered committee. Prime Minister is there only for one meeting. So this squabbling between states cannot continue because real people are dying. And in the same vein, this government is showing its usual ways of PR and propaganda in response. The hospitals across the country, yesterday the positivity rates in more than 170 districts were above 15%. Over 200 districts, 5 to 15%. There are hospitals there. Hospitals require the medicines. Where is that chart that tells that all the medicines are there in those hospitals? If there are 30 lakh active cases in the country, that means at least 3 lakh beds are going to be required with oxygen. 10%.
No, Mr. Tiwari, can I tell you something? Right now, it's very convenient for the states also to say, see, center did not do this, center did not do that. The point is, everybody can, number one, not admit that we all failed. This is a collective political failure. But the point is, once you make that admission, after that you can at least address the situation right now. You can't have a situation in this country, Ms. Priyanka Chaturvedi, where hospitals, instead of treating patients, have to go and fight cases in courts. It's unfortunate.
I just say one thing.
No,
Right?
Sanket, I just like to say one thing here.
Yeah.
It is very incorrect and unfair to tarnish everyone with the same brush. Please don't brush under the carpet the Epidemic Act which is in place. Don't brush under the carpet the Disaster Management Act which is in place, which empowers the central government to take a call.
So the center has more responsibility.
Every single state. No, please allow me to complete, Sanketji. And I'll tell you why. Now, Mr. Jolly was very well asking me, what did the states do? I'll tell him what the states did. The states alerted the central government that we are running short of vaccine. The states alerted the government that we are running short of oxygen, and that's something you should prepare for. The states also, ensured by informing the health ministry that, listen, very soon there could be a criticality of remdesivir. I will, I can quote my own Feb 25th interview where I said that Maharashtra could be facing a second wave because the Chief Minister continued to speak about it.
The center said that we are also alerting states. We issued 4 press statements, one in January, one on 27th January, one on 7th of Feb. These are documents that have been released only yesterday.
I'm sorry. No, I'll tell you something, Sanketji. This is Amit Malviya's press releases which he brought together. If you read those 4 documents, what do those 4 documents say? Are you all tracing, tracking and treating? Have you all ensured that there is enough tracing, tracking, treating happening, testing happening? Those are the 4 alerts that are coming, which could have been any ordinary bureaucratic drivel which is being sent across. Was it, if it was specific that there is a second wave coming, we are preparing you all with oxygen, with remdesivir, with vaccines to ensure that we cover a large amount of population, percentage of population? No, they did not do that. They allowed the ECI to conduct elections across 5 states. While we speak, we still have panchayat elections happening in Uttar Pradesh. By-elections have happened. What was the health ministry doing? What alert are you talking about?
Okay. Okay, Mr. Jolly, would you like to respond?
They were general letters which were sent across. I hope you all are testing enough. I hope you all are doing the tracing, tracking, treating. Boss, 30th September. Let's talk about September peak cases in Maharashtra. 30,000. What are we standing at now? A second wave has hit us so hard. We are standing above 67,000 cases. Thankfully, we have plateaued. Delhi continues to see a rise. So what are we even talking about?
Yeah. Okay, Mr. Jolly's response and then Mr. Shah.
You see, with all the humility at my command, I wish to remind respected Priyanka ji. On 12th March 2021, Prime Minister Narendra Modi convened an urgent meeting on COVID. Who were the chief ministers who did not attend? The Chief Minister of Chhattisgarh, a Congress leader, and the Chief Minister of Bengal, Mrs. Mamata Banerjee. And it was again the same Chief Minister led by the Congress party who worked and who spoke against the Covaxin manufacturing in the country. He raised several objections. One hand you say that you are cooperating. On another hand, the same Chief Minister of Delhi, respected Arvind Kejriwal, on 7th June 2020 had stated Delhi hospitals and private hospitals shall only treat Delhi residents. And on 22nd April 2021, my Delhi Chief Minister on the oxygen crisis says states should help each other in this problem of corona pandemic. What is this double talk? If you want to work with the center,
Ms. Chaturvedi's question was with respect to Maharashtra. If you could quickly respond.
Narendra Modi allocated today.
Ms. Chaturvedi's her intervention was specifically about Maharashtra. If you can respond, and then we'll move on. Mr. Jolly.
Yes. What I was just trying to say, it is not only Maharashtra, it is all about the country. And today, what the Prime Minister has announced, 80 crores poor Indians shall be given 5 kg dry
No, that is true. We need oxygen. I'm saying, where is the massive
oxygen is being transported by the railways and the airport. Was this initiative taken at the pressure of Maharashtra or Delhi? This has been taken in the interest of the national citizens to safeguard their lives.
Okay, one more. Ms. Chaturvedi, I'm going to come back to you. Jasmine Shah. So Jasmine Shah, Vijay Jolly says that this decision is not being taken simply because of the pressure of some chief minister of some state. It's been taken in national interest. Now, is this the best decision? Was it a delayed decision even in this hour of crisis is the big question. Yes, Jasmine Shah.
Sanket, I think we need to first have the honesty to acknowledge an issue and understand why did that issue crop up. Today, we are in the midst of a horrible, horrible oxygen crisis in the national capital. I'll not talk about other places. Not because, I mean, yes, there is an issue of long-term planning. We can always keep blaming who did not do the planning, who ought to. But the fact is, whatever has been planned, 350 metric ton of oxygen has been committed to Delhi by the central government. But for the last 4 days, it was 380 earlier. 2 days back, it was increased to 480.
Yeah.
But the challenge is not that this quota has not been increased. The challenge is that on the ground, something else is happening. Trucks are not being sent out.
It's not reaching Delhi.
Each state has become a fiefdom, and the chief minister is saying that tell me which number should I call if my truck, which is trying to save life of 100 critical patients, gets
Mr. Jolly,
and the
Mr. Jolly, very quickly, will you respond? Where will a chief minister right now? What we get from the BJP? What we get from the BJP? Oh, you should have built oxygen plants. Now that's surely not happening in a day or two, no? In the meanwhile, what will you tell patients in hospitals?
You see, Sanket, to put the record straight, April 1st week 2021, Delhi government gave a projection of oxygen 300 metric tons.
No, Mr. Jolly, by that logic, every state's projection has gone wrong. Mr. Jolly, every state, UP has gone wrong, MP has gone wrong, all Gujarat has gone wrong. All states have gone off their projection of the requirement of oxygen.
Let's not talk about planning. Let's talk about execution.
Tons is being manufactured in the country, and out of that, 6,600 metric tons has been allocated over to the states. And I wish to ask,
there is no answer to why trucks are not reaching Delhi.
The direct route from Panipat to Delhi for the IOCL supply of oxygen cylinders, which is only a state route from Panipat to Delhi. Has the Chief Minister of Delhi appealed to the Singhu border farm protesters?
No, they've said that they've opened a route. The farmers say they've opened a route. It's the police barricading which is creating the problem.
There is no problem at all.
See, one more, Mr. Jolly, there will be an allegation against you that you are looking for Apda mein Afsar, right? In the courts, suddenly there are conversations about reopening the Sterlite plant, and here in Delhi you see blaming the farmers. Now my point is, whether it is correct or not is debatable. But the point is, please don't use this as a political opportunity to beat matters or fix matters that you haven't been able to. Priyanka Chaturvedi and then Mr. Tiwari.
The last point, I'd like Mr.
Very
Jolly,
quickly,
Mr.
closing
Jolly,
comments.
It is very fine.
Yeah.
It is very fine for you to accuse everybody, but refuse to look within about how y'all have spectacularly failed to understand there was a second wave coming, which could be deadlier than the first. And that is the truth. Y'all were patting yourselves on the back. Feb 21st. BJP meeting which said that he is a Mahapurush, for Narendra Modi ji is a Mahapurush for ensuring that we have seen the back of COVID. This is the truth, and Feb 21st declaration that has come across the BJP conclave.
Okay,
now,
Ms. Chaturvedi, see, the thing is, as it is said in Hindi, jo beet gayi so baat gayi, that is not going to provide oxygen to people.
I will 1 second.
It is not going to solve an immediate problem. My bigger concern is, I'm running out of time, bigger concern is, how do you fix the problem? Are we dealing with it properly even now? That's the big crisis. Unfortunately, we are not. Thank you very much. I've run out of time. Thank you to Priyanka Chaturvedi, Ghanshyam Tiwari, Vijay Jolly as well as Jasmine Shah for joining us. We take a short break at this moment, but news continues on the other side. Stay with us.